Okay, well, why don't we get it started? Again, good afternoon and good evening, everybody. I am Paul Melmeyer. I'm the Vice President of Public Policy and Advocacy at MDA, and I'll be your host for this evening as we talk about some really exciting accessible air travel updates from Capitol Hill. And then we'll also talk about some additional insights of the year ahead of what we're going to be up to and what we'll hope you will join us for going forward. So, this is our February Advocacy Institute. As you know, we hold our Advocacy Institutes about once a month or so, where we cover what might be most topical in the Washington, D.C. area as we're serving those in the neuromuscular disease community. And as we were putting together today's presentation and agenda, clearly the progress within the FAA reauthorization and all of those accessibility provisions within jumped out to us as something we definitely wanted to tell you more about, because over the course of the last little while, we of course been asking for your support, your participation, your voices, and asking to make air travel more accessible on Capitol Hill. So after we get done with our introductions and housekeeping, I'll be turning it over to Heather Ansley at the Paralyzed Veterans of America, who is truly one of our leaders on accessible air travel. And she's going to walk us through what the House has been up to, what the Senate's been up to pertaining to accessible air travel within their Federal Aviation Act reauthorization efforts, and then where do we go from here? From there, I'm going to share the stage with Joel Kartner. Joel is MDA's Director of Access Policy, and we're going to be talking about in the year ahead what MDA is going to be doing to try to increase access to care as it pertains to our work on Capitol Hill. And then I'll fill in from there on our accelerating therapeutic development efforts, as well as our efforts to serve those with disabilities beyond accessible air travel as well. Now we'll have time for your questions at the end for anything or everything that's relevant to our topics today, and we'll also take some questions with Heather specific to the FAA reauthorization effort in air travel following her presentation. So let's move to our next slide. Just a couple of housekeeping items as I teased. Here we are on WebEx, of course, and you can see a couple of the buttons on your screen here that pertain to the image on the slide. So for those of you who want to use closed captioning, please go to the bottom left of your screen. You'll see the little CC there. You can click closed captioning there. And to interact with us, we would invite you to post questions to me, to Heather, to Joel via the Q&A box. And you can get there by clicking the three little dots in the bottom right of your screen, and then up will pop a little drop down and Q&A is right there. So again, please put your questions into the Q&A throughout the program. We'll probably be saving some to the end. There might be some that we answer as we go along if they're particularly relevant to the topic at hand. But either way, please do send those questions in for us to answer. Okay, so let's move to the next slide from there. Actually, one more thing to mention: this is being recorded as well. So for any of you who might be furiously scribbling notes down over there, don't worry. In a little bit, we'll have the recording up on our website, and you can tune back in and listen to anything potentially that you missed from our presentations today. So as I already teased, of course, our guest of honor is Heather Ansley, and she's the Chief Policy Officer at the Paralyzed Veterans of America. And we've worked with Heather for a very long time on all things accessible air travel, as Heather is truly one of, if not the leader on accessible air travel for those with disabilities in Washington, D.C. and beyond for that matter. So Heather will be, we're very grateful for your time this evening. Following Heather's presentation, Joel, as I mentioned, our Director of Access Policy, and I will cover some of our other policy and legislative agenda items for the year. But without further ado, I think I've teased it enough. Heather, I'm going to turn it over to you. Tell us what's been going on up in Capitol Hill these days on FAA reauthorization and accessible air travel within.
Well, thank you, Paul, for the introduction and the kind words. It definitely has been wonderful to work with MDA on the issue of improving access to air travel for people with disabilities. It continues to be a top issue for a lot of members of the disability community. I know certainly members of PVA. For those who don't know us, Paralyzed Veterans of America is a congressionally chartered veteran service organization. All of our members have spinal cord injuries or disorders such as MS or ALS. And the vast majority use assistive devices. And so PVA has been involved in efforts to improve access to air travel since before we had the Air Carrier Access Act, and taking actions to get that in place, but also since then to try to make improvements. And the FAA Reauthorization Act has been a way in recent years that we have seen efforts to move legislation around air travel on Capitol Hill. There's nothing that requires them to only do it as part of the FAA reauthorization, but that has been their cadence. That might change according to some, but that's where we are for now. So the current FAA reauthorization, the most recent one was passed in 2018, and it expired last year. Congress has continued to extend the current authorization, and right now the current authorization is in place until March the 8th. We had a lot of movement last year in both the House and Senate on the FAA bills, and everybody had hoped we would get it done before we reached the first expiration, so they wouldn't have to keep extending. And the House made good progress. The House bill, H.R. 3935, the Securing Growth and Robust Leadership in American Aviation Act, passed out of committee in June of last year. I think it was completely, there was no people that were against it. It was completely bipartisan, sailed out of committee, went to the floor in July, and passed by good wide margins. So the House got their part done. The Senate, on the other hand, they were supposed to have their committee action in June, and ended up having it pulled at the last minute due to issues around pilot training. So nothing to do with the disability or consumer issues, but related to pilot training, they had some disagreements. And so for 8 months, the Senate was basically sitting on the tarmac, not moving in terms of taking further action on their bill. And the Senate bill is the FAA Reauthorization Act of 2023, S 1939. Well, we finally had some action, and we had the bill, I guess it was about 2 weeks ago now. The Senate Commerce Committee held a markup. So that's where they go through the rule legislation and see if they're going to make amendments or what they're going to do moving forward. And then they can pass it out of committee so it can then head to the floor. So they adopted an amendment at the beginning that included a lot of bipartisan provisions, including a couple of disability ones that we'll talk about. They considered two other amendments and without much fanfare said, okay, committee action is complete. So now we're at the position where the House bill is passed, the Senate bill, the Senate bill is now ready for, action potentially on the Senate floor. And then we also have the expiration of the existing authorization on March the 8th. So there's a lot of, consideration about what might happen next. Informal conference with the House to try to get a final bill that both could agree on. Might need another extension still. So what's going to happen in terms of getting to the final bill is still a little uncertain. So we want to make sure that the final bill takes the best of all of the disability provisions that are in both the House and Senate bills and gets those into a final bill, so that the final FAA bill, which is going to be a 5-year reauthorization, is going to have some strong provisions for DOT to work on, in those intervening years. And we are pleased that both the House and Senate versions of their FAA bills, like I said, do include several sections focused specifically on the issues that passengers with disabilities frequently encounter. And while many people with disabilities have problems in accessing air travel, whether it's those who use wheelchairs or those with service animals, those who are deaf or hard of hearing, blind or low vision, those with cognitive impairments. There can be lots of difficulties that people face One of the things that is of most concern to PVA, and I think other organizations like MDA, has been the problems that wheelchair users encounter, and the difficulty in getting on and off the aircraft, the antiquated way in which that takes place that has led to people being injured in that process, wheelchair damage. We're all very familiar, unfortunately, with that situation. And how do we get to a point where we're not damaging wheelchairs and we're not injuring people and everybody's just having the same flight experience, good or bad, and not worse because you're a person with a disability? So we have provisions that are in both the House and Senate bills. A couple of those will start out with our training requirements. So there are provisions that would look at strengthening the training that's required for those who are assisting passengers with limited mobility in getting on and off the aircraft. So making sure they have hands-on training in this process. Making sure that they've proven to someone that they can do this before they're sent out to go and physically pick someone up and lift them and move them. So that's one piece. The other piece is, of course, once the person gets separated from their device, what about the training for those that are moving the wheelchair? So there's provisions that would require training for those individuals. So if they're down on the tarmac trying to get that wheelchair into the belly of the aircraft, we want them to have had training hands-on about, working with, the most typical types of devices, so that they are familiar with what the processes are. They understand how to work with the chair. They understand the importance of the wheelchair. It's not just another piece of baggage, that it is very critical to the person on the plane that wheelchair come back in one piece working, so the person can get to where they need to go. So those are two really important things. Like I said, they're in both the House and Senate bills. The language is a little different, but it's pretty similar. Moving on, there is another provision. Again, it's in both the House and Senate bill, looking at the complaint process and trying to make sure that the complaint process, we get it moving a little quicker. If you file the complaint with DOT, you've probably waited quite a while to get the response. You may have been frustrated once you got the response. But we want to have requirements that DOT have some more markers in terms of how quickly they're moving on those. So we have a House and Senate section that looks at that issue. The House language is a little stronger, but there is good Senate language as well. We have another provision, again, in both bills that would look at we call it access standards, basically looking at standards for aircraft and people getting on and off the aircraft. How can we strengthen that area? We looking at the in-flight entertainment, accessibility around that. Also looking at visual and tactile accessibility, and then requiring a negotiated rulemaking on flying while in your wheelchair in the cabin, depending on the results of the economic feasibility study that's in another part of the bill. So there's a lot of good provisions in there, and the complaint provision I mentioned and the standards provision, those are not directly from the Air Carrier Access Amendments Act, but they were based on that. So I know that was a bill that many of us have worked on, that those provisions came from there. There's also a requirement to look at websites, applications, some of the technology and accessibility. There are provisions in both the House and Senate bills. They look different. So we're hopeful we will get the one that's the best in the final bill. There's also requirements in both the House and Senate bills to look at the continued study into the safe and secure in-cabin wheelchair tie-down. So basically being able to fly in your wheelchair. It's building on the study that was required in the last FAA reauthorization. And this one includes trying to sew up the parts that that study identified in terms of the technical feasibility, if you will, but also requiring a study on economic feasibility. That tends to be the two part. One is, can we do it and can we do it safely? The next one is, how do we do it in a way that allows people to be able to stay in their wheelchair and that it can be done economically, if you will. Basically, it can meet the requirements. This is not dissimilar from what we saw with the lavatory rule. You may remember last year there was a rule that came out about lavatories and access on single aisle aircraft. It's the same type of process. So this would put into statute that process needs to continue to move forward. It also requires a more in-depth analysis of the information that is being provided by the airlines to the Department of Transportation about the number of wheelchairs and scooters that they mishandle. And mishandle means that it was lost, delayed, or damaged. And right now, that's pretty much all the airline has to say. In the month of May, we mishandled 100 wheelchairs. That's it, nothing more. We think it would be helpful if they had more information about what exactly is happening. Are wheelchairs being delayed? Are they being damaged? Is it manual wheelchairs? Is it power wheelchairs? What type of damage? So there's some pretty specific requirements that they would have to start reporting about what exactly is happening when you mishandle a wheelchair. We think that's important. The legislation would also reauthorize the Air Carrier Access Act Advisory Committee, which was created in 2018, and it would increase disability representation on other passenger committees that aren't disability focused to make sure that passengers with disabilities have a voice on those committees. And we think that's pretty important. And there's also a focus on the needs of passengers with disabilities in evacuations. Right now, there is no consideration of the needs of passengers with disabilities or small children or people with, older people who speak maybe a different language than the language of the airline, and no real consideration about getting them off the aircraft safely in an evacuation. So looking at that. I will mention that there are a few provisions that are only in either the House or the Senate bill, and we're hoping that these will still end up in a final bill. But for instance, in the Senate, there's a pilot grant program to increase airport accessibility. And one of the things that would look at is, meeting ADA requirements, but also are there things that aren't technically ADA requirements, but would help the airlines better comply with their requirements. And a good example of that is, as long as we have wheelchairs going into the belly of the aircraft, right now, those have to go up the jet bridge and go into the airport to find the elevator that takes them down to the tarmac. And in some airports, that elevator may not be very close by. So we think airports should consider, when they're, doing expansions, they're doing remodeling, whatever, where are those elevators located that are taking the wheelchair down to the tarmac? They should be as close as possible and convenient to decrease the delays that people can experience. It also helps to make sure they get down there a little more safely. Another provision that is only in the Senate bill is requirements and training related to onboard wheelchairs. So that's the wheelchair that stays on the aircraft, and it's the one that you would use if you needed to use the lavatory during flight. There's some concern about the training that's there, the requirements to have those, and that's going to become more of an issue as more aircraft do get that accessible lavatory on board. There's also in the Senate bill an expansion of an FAA Center of Excellence to make sure that, which is kind of they look at study and research to make sure that they're considering accessible air travel for passengers with disabilities as part of that. So we give funding to do some of that work. And then also just in the Senate bill, creation of a known service animal pilot program. DOT has done some changes to their service animal regulations in recent years. that hasn't solved issues. In fact, it's created a lot of problems for people with service animals trying to get on and off the aircraft. And so there's an effort to create a pilot program that would kind of look, the vision is a little bit like a TSA pre-check, but for your service animal. I don't know that it would have a cost, but that it would indeed mean trying to decrease the hoops that service animal users have to go through just to travel with their animal. And then only in the House, so this provision's only in the House bill, there's a provision focused on ensuring access for assistive devices that are powered by lithium ion batteries. More wheelchairs, scooters are being powered by lithium batteries, and lithium batteries have really, really strict requirements in how they can be carried on the aircraft. And this bill actually came from Representative Jim Langevin. He is a wheelchair user. He retired at the end of the last Congress. And his wheelchair uses a lithium battery, and he encountered problems trying to travel on official business because of his wheelchair. So this was a bill that he asked that Senator Dina Titus, the representative from Las Vegas in Nevada, continue in his departure. So that's in the House side. So there's a lot of, that's all to say that there are a lot of provisions that continue the work. Frankly, we didn't get everything we wanted. We didn't get the private right of action so that people can go to court and enforce their rights. We weren't able to get Department of Justice involved in enforcement, and we didn't get the stricter standards that we wanted. Something to know about how the FAA bill was molded together was that pretty much everything that's in it to this point, and except for the action on the House floor, had to be bipartisan. Pretty much if they couldn't all agree, it didn't go in. That was the case on the House side all the way through the committee. And on the Senate side, that was really the way they tried to be. So that's why we weren't able to get some of the things we wanted. It's why other people were not able to get some of the things they wanted in the bill, because we just couldn't overcome that particular you know issue, sometimes getting bipartisan support for things. But moving forward, as I mentioned, we're at the point now where that the House and Senate committee action has taken place. And we've got a deadline coming up with the reauthorization that we're thinking we're going to start seeing some action. Committees are having conversations now about maybe what should be in the final bill. And we hope that we're in good stead, in part because we have so many things that are in both the House and the Senate bill. That usually helps when you have to conference things, because folks can say, well, you guys did it, we did it, so there must be some level of agreement. We'll include some version of that in the final bill. It's sometimes a little harder if there are things that are only in either the House or only the Senate, but that doesn't mean it can't be in a final bill. It just means that maybe it'll be a little more, it might require a little more work, if you will, to get it in the final bill. But we're hopeful that this will be a good opportunity. We're also hopeful with, quite frankly, some of the stuff we've seen in recent air travel incidents that have taken place. We all remember the Alaska Airlines issue, and we're starting to hear that maybe they might want to do aviation legislation for consumers a little more often than just when they reauthorize the FAA. So maybe we won't have, if we get this done, maybe we won't have to wait 5 years to make additional improvements. But that'll have to be something for another day. In the meantime, we're hopeful to get a final bill here. And that's pretty much what Congress is doing right now on air travel. So, Paul, I'd be happy to take any questions that folks may have.
Yeah, thank you, Heather. That was a fantastic overview, and I hope everyone listening really can actually grasp the gravity and really the scope of accessibility provisions that are within both the House and the Senate FAA reauthorizations. When talking to people about these bills, I basically described that the FAA reauthorization essentially governs all kinds of things in the sky that aren't military. Pretty much everything falls within the jurisdiction of this bill that is not military based. And for example, in the Senate, there's a whole section specific to accessibility for those with disabilities. So it just goes to show of the full scope of things that senators and representatives could be considering for this bill, that the number of accessibility provisions and the scope of those accessibility provisions within each of the bills is truly astounding. So something certainly to celebrate by all means. We've been really getting some fantastic questions both in the chat and in the Q&A. Really appreciate that. And I think unsurprisingly, a good number of the questions and the comments really center around wanting to be able to fly within one's own wheelchair. That is, again, the ultimate goal for wheelchair users, and is coming through quite clearly from everybody in the chat and the Q&A as well. So a couple questions related to that, and actually there's a good kind of primer question, if you will, of why people can't do that today. What has prevented folks who are wheelchair users from being able to fly in their wheelchair thus far? What have been the stumbling blocks leading up to this bill that has prevented folks from flying within their wheelchairs?
So that is a good question. And in terms of commercial aviation, really the thing that we felt like we needed to knock out of the way if we wanted to get to the point of people being able to fly in their wheelchairs was that technical feasibility. And as I got into working in on air travel, I learned that there's nothing on a plane that isn't required to be there, and it is all highly regulated. So I know that for many people, the inside of a bathroom in an airplane isn't someplace that you can go because it's not accessible, and it's not accessible to get there. But I can tell you, if you find yourself in a lavatory on a plane, you will notice on the door there is a place to put out your cigarette. You cannot smoke on an aircraft. It is against the law. It's against federal law. But I learned that they have to have an ashtray on that door in case someone breaks the law. They need a place to safely put it out so they don't put it in the trash and burn the plane up. So that's how specific things are in the regulation. And what they're doing right now, and there's a lot of efforts right now working toward flying in your wheelchair, a lot of research. FAA is working on this. There's a lot of people working on it. And the thing we have to come up with is that safety. So what are the mechanisms that are needed to be put into place that FAA would say, if you meet these requirements, we would certify that this is safe and you can in fact do it. Right now, they're looking at securement of the wheelchair. How would this, the wheelchair secure to the aircraft, but then also securement of the passenger. What would that look like? And there's a lot of things that they're looking at in terms of that technical feasibility. Once you satisfy that, you say, okay, yes, it can be done. We meet these requirements, good to go. Then another part that's important to consider is, I mentioned that economics, because then we're going to have probably regulations from DOT saying, okay, this is what airlines now have to do, and all regulations have to have an economic consideration. That's just a requirement. So it will be looking at, what does that look like? What does it mean? What is the impact? Is this on all aircraft? Is it on larger aircraft? What does it look like? And so I do know that we all want this done like yesterday, and it should have been, right? It's 2024. But there definitely are, in the time I've been doing this, there is more being done now on this issue, and it's no longer something that seems like, oh, well, maybe that's a nice idea. There are actual people working on this, and you can touch them, examples of how this would work. So take heart and know that this is the goal. This is where we're moving.
Yeah, very well said, Heather. Absolutely. And MDA, for example, has partnered with All Wheels Up, one of our sister organizations in this cause, to actually fund some testing at the at Wichita, Nebraska, for that matter, focused on trying to get the data necessary to contribute to understanding the technical feasibility of flying within one's own wheelchair. We had a really good question about what you referenced earlier, Heather, about some of the studies actually already being done. The last FAA reauthorization already has checked some of the boxes, if you will, in studying the feasibility, the technical feasibility of flying within one's wheelchair. Could you maybe say a few words on what we've found so far, and then what we still have yet to find? What still needs to be studied within the next stage of technical feasibility studies to really definitively ensure that flying within one's wheelchair is safe?
That's a great question. And one of my favorite parts that was in the study that we frequently reference is the study was done by experts. There weren't advocates, disability advocates. There were not airline advocates. It was really the science research people, the people who do aircraft interiors, who looked at this, and some of them were people with disabilities, because two of them were PVA members who also happened to be engineers, and wheelchair users. And they said, we've found nothing that says this can't be done. That was a very important statement to have, that was independent, based on, like I said, people who do this for a living, who design the aircraft, and design what's included. So that was part of the next step. Some of the things they looked at, for instance, are, yes, we have securement in vehicles. Vehicles don't look for people going up and down like you do in turbulence. So it's usually forward, backward. So there are some things that they need to look at related to how does the wheelchair act, like what happens to the wheelchair in different types of movement. And it's not just what happens to the wheelchair, it's what happens to the wheelchair in terms of the passengers around it. Do things fly off of it? Does it move? I mean, just all of those various pieces. If you think about how tightly you're crammed into a passenger compartment in an aircraft seat, all of those things are considered. So those are some of the things they need to look at. The TRB study also really talked about demand and routes, and where would we have would there be, is it all aircraft? Is it some? Is it larger? Is it certain routes have more than others? Those are other questions that people wanted to look at. And then they really said that, DOT needed to lay out a research roadmap to get those questions answered. So what's happening now is FAA is looking at the research, and they're saying by next year, maybe the year after, but they're hoping for next year, based on the research, they will be able to write what the requirements are, such that when something is provided, for a company to look at, what do we have to do to meet the requirements, FAA will be able to tell them, this is what you have to look at to meet the requirements. And that's huge, because then once you get that certification, because if FAA says something isn't safe or won't approve something, it's a hard no-go. So that is part of the testing. So
Yeah, very good. Thank you, Heather. So just to kind of summarize then, for what's proposed within the bills, it's the kind of completion of the technical feasibility studies. We check all of those boxes. Then we also do the economic feasibility study. I appreciated a comment in the chat about how those studies should really actually make the argument for the airlines that allowing folks to fly within their wheelchairs is actually economically beneficial due to increased demand. And I think actually we would expect that the economic feasibility studies would oftentimes would show that. And then from there, the negotiated rulemaking happens. And Heather, you've been part of negotiated rulemaking before. Can you just give us maybe 60 seconds of what that entails and what we could expect from that stage?
yeah, so a negotiated rulemaking is where DOT puts out a request to get stakeholders to ask to be on a committee. They pick a committee, and then they give the committee a charge. And it's basically to try to come up with a rule that all sides could live with. So it would include airlines, people who make planes, aircraft interiors, people with disabilities, probably wheelchair manufacturers, to come together and see if they could basically draft what would be in a rule. And if, depending on how they vote, it gives the ability to say, usually what DOT says is if you guys can come to an agreement, we'll publish what you agree to. So that helps get over the hurdle of industry who may not want to move forward on something. That's how we finally got a lavatory requirement. I was part of the negotiated rulemaking on lavatories. It kept the issue alive. And also, even though it's still from October, it's still 10 years, we literally had been talking about this. I have studies in my office going back to the early 90s, 92, where we were talking about this. So we finally, through the negotiated rulemaking, got a date. Like we actually now have a date, which we have not had for 40 years, on how to get to that point. So the negotiated rulemaking can be a way to like get people's buy-in. They're not always successful. So for people who don't know, the Air Carrier Access Act regulations, the first regulations were part of a negotiated rulemaking, and it failed. And the department took what was left of the failure and wrote the rule. So they've used this a lot in air travel. And now it's at the point where we're at this particular position. And we know that things, they don't move as fast as we would like. We don't have, if we all could write the rules and run the world, let me tell you, it would be very different.
Mhm.
But we don't. So we wanted to make sure that we at least didn't have to keep talking about things that agreed should have been done decades ago.
Mhm.
And we're not done. We at least wanted to be able to say that it's there, and it's going to happen, and we can stop having to convince people that it's important.
Yeah, absolutely. I think about the accessible lavatory negotiated rulemaking and then ensuing rulemaking from there, and how I believe the airline industry within their requests for the duration of the timeline for implementation, I think asked for 27 years of implementation timeline, if I remember correctly. This was after the Department of Transportation proposed about 18 to 20 years of implementation timeline. And then finally, in their final rule, they cut it down to 10,
Yeah.
which again is too long, and that's reflected in the comments and in the chat. And many who hear 10 years, that's great. 10 years just have an accessible lavatory, and it is. The silver lining, if you will, is that the airlines, not only did they not really want to do it at all, but when they were forced to do it, they said, okay, fine, 27 years is how long it's going to take. At
Yeah.
least it was 10. So just goes to show what advocates like Heather and folks like Heather are up against when it comes to these situations with the airline industry and others with these kinds of timelines. Just a couple more questions. I know we're really almost out of time for our topic this evening on accessible air travel, but there are so many interesting questions coming into the chat box and the Q&A. There's a couple questions on how people can really get more involved with a number of these provisions. Are there opportunities for folks to get involved with the new training standards and the training that baggage handlers as well as airport or airline personnel are going to have to undergo if these bills pass when it comes to assisting an individual with a disability in a tree seat transfer or in a baggage handler loading a wheelchair into the belly of a plane. So is there a role for those with disabilities there? And then the second follow-on question is for these committees that are being created, including the reauthorization of the Air Carrier Access Advisory Committee, are there opportunities for those with disabilities to participate within those committees?
So yes, all good questions. So what's happening at the same time Congress is creaking along, there's another process happening over at the Department of Transportation. And they are going to be releasing at the end of this month a rule focused on passenger issues in air travel, specifically for wheelchair users. And from what they have publicly said, that is going to include training. We don't know exactly what they're going to propose, but it is going to include training for those that assist people with disabilities and wheelchair stowage. So that will be one thing. Is it's going to be important for people to comment during a regulation, a proposed regulation. You have an opportunity to put your comment in about why it's important, about what you think is needed in terms of training. And we're going to work with other disability organizations like MDA to provide tools to help folks comment. But we need a lot of voices telling people how important that training is. And again, what's needed, what type of training is needed. So that's one like concrete way your voice can be heard like very soon. That's coming in a matter of weeks. And then there will be opportunities to, how that's going to be implemented. The other piece was about the advisory committees. So the Department of Transportation advertised for a new group of folks to serve on the Air Travel Advisory Committee. It may have been a couple of years ago now. It's been a while since they put out the announcement. They have not selected people for the committee. So I don't know if they're going to eventually abandon that and start over, or if they're going to go from the people who put in their applications so long ago. But that committee it's there, but the getting people on it is a bit in limbo at the moment. If these new opportunities come up through the general passenger committees to add disability slots to them, those will all be announced by the Department of Transportation and to the public, and people will be able to nominate themselves, have other people nominate them, and then the department would consider the nominations, and then they would pick a final committee. So there actually are quite a few ways right now that folks can get involved in terms of looking at what Department of Transportation is doing, but also just continuing to contact your members of Congress and remind them that we need a strong disability provisions in the final FAA bill.
Absolutely. All right. Well, Heather, I think we can pause the conversation there. Again, very grateful for your time this evening and joining us on these very exciting developments from Capitol Hill. And actually, just as a tease for everybody, Heather just mentioned some upcoming rulemaking that the White House and Department of Transportation is going to be announcing, very likely going to be announcing 1 week from today, Thursday the 29th. And actually, I'll tease also for all of you, our next Advocacy Institute in March is going to be on that proposed rule. We'll tell you all about it there. So there'll be more opportunities certainly to be talking about that role and how you can get involved. But at least for this evening, Heather, again, thank you so much for joining us to walk us through what is within both the Senate and the House FAA reauthorization bills. Very grateful for your time this evening and, of course, your dedication and time to the cause, as you can hear from everybody in the chat, something that resounds quite clearly to everybody within the neuromuscular disease community. So thank you.
Thank you very much, Paul. And thanks everybody for your advocacy. Keep it up. That's what's making a difference.
100%. Okay, well, very good. As Heather heads off to her evening, we are going to move on to just let you know what else is going to be happening on Capitol Hill. And then what I will say, there are so many questions that we haven't been able to get to. While Heather is on her way out, we'll be able to answer a lot of these questions. And if we have to go a few minutes past the top of the hour, that's okay. But I think there are some that we can go through relatively quickly to give you the facts there at the end of our conversation here. But for now, what I'm going to do is I'm going to welcome Joel Cartner, our Director of Access Policy, in to tell you a little bit about what's on the agenda for this year within our efforts to increase access to care. So Joel, I'm going to hand it over to you.
Thanks, Paul, and hi, everybody. So as big a year as it is for air travel, it's also a pretty big year over here in access to care land. As you all may or may not be aware, there's a really big opening in our priorities in terms of telehealth will be up for reauthorization at the end of this year. So as a reminder there, back during the public health emergency, there was a very large expansion of allowable uses of telehealth in terms of providers providing visits to patients via telehealth. That's both MDs as well as physical therapists, occupational therapists, kind of across the board. Those flexibilities were extended once, and then now we're at a point where at the end of this year and the end of 2024, those expansions are up for reauthorization once again. And we're fairly confident that those extensions will be granted either for a period of another few years or permanently, depending on what Congress decides to do. So that obviously was a huge piece of accessibility in the healthcare space, particularly for people in rural populations or for people who had specialists, states and states away, which you all, of course, are very familiar with. So that all by itself is, a big opening. But also what that does is it creates what we call a moving vehicle in the public policy space. And essentially what that is it's one big piece of legislation that we know is going to have to pass. And so then we get to ask ourselves, okay, what else can we stick in to this moving piece that's related, so that we can continue to see progress there. So we're also excited about those opportunities as well. And the list you see below, it's not an exhaustive list of what we might be able to get in, but in terms of just here are the big highlights for what we might be able to slide in there along with the telehealth extensions. So obviously telehealth being involved in getting you access to a physician, there's also a lot of potential in terms of access to diagnostics being able to be slid into that bill as well. The biggest ones there are the Access to Genetic Counselor Services Act. That is on the House side, HR 3876. It was sponsored by Adrian Smith and Representative Higgins on the House side, and then on the Senate side, that is Senate Bill 2323, sponsored by Senator Barrasso. So that one's a pretty big one. Basically, it would allow the coverage for genetic counselor services. So getting you that diagnosis that you need under Medicaid, which is obviously huge. Or I'm sorry, Starting Kids Access to Care is ensuring that you can see your physician across state lines more easily. Right now, outside of a telehealth setting, if you're trying to bill under Medicaid, there's a very long way that you have to go about doing that. And essentially what this bill does is it streamlines the process, specifically in pediatric patients, to get them moving. And then Accelerating Kids Access to Care is 4758 on the House side, and that is Rep. Trahan and Miller Meeks. And on the Senate side, that is 2372, and that is Senator Grassley on the Senate side. So those are both really big openings there. We were very close to getting both of those in at the end of last Congress. So there's a lot of groundwork that we've already laid there in terms of getting it into a final package this year. So we're very excited about that. And then there's the Accelerating Kids Access to Care Act, or sorry, Precision Medicine for Kids Today, which is not a bill that's been introduced yet, but Representative Swalwell has been a major player on ENC for several years now, and so he's got some pretty big sway. And we've been working with a lot of different entities across different patient advocacy organizations, people who make testing equipment, people who are involved in precision medicine in general, to try and get that moving up the hill. So there's a lot of momentum there. And essentially what that does is it's very similar to genetic counselors in that it attempts to authorize the use of whole genome sequencing, again, in Medicaid services to try and ensure that people are getting access to that diagnosis that much more quickly, which, as you all are aware, is just so vitally important to getting you to treatment that much faster. Can't get good treatment if you don't have a good diagnosis. Outside of the diagnostic space, there's the ALS Better Care Act. For those of you that follow us on LinkedIn and Twitter and all those things, you'll see that we were up on the Hill on that just last week, talking to a bunch of people, trying to get that moving up the hill. It's essentially in ALS right now, under Medicare, the only people that are allowed to bill for services are the treating physician and the RN. And those of you that know someone who lives with ALS or live with ALS yourselves, there's a lot that goes into the care of ALS. So you've got your PTs, your OTs, your speech pathologists, your mental health. None of those folks are allowed to bill in a multidisciplinary setting. It all has to come through the MD. And so that ends up costing healthcare providers a lot of money in terms of reimbursement, and so they're less likely to want to provide those services, which of course then causes problems for you, the patient, in terms of there are less multidisciplinary care clinics. And so you have to travel farther to get that care that you need. And when you're not traveling to multidisciplinary care clinics, you're receiving care more locally from providers who aren't necessarily as well versed in ALS, or you're going to an emergency room, which is of course very expensive. So hopefully by providing better reimbursement models under the Medicare statute, we can incentivize the creation of more clinics, which then of course has trickle-down effects to the patient. Home and community-based services is another huge issue for all of us here. There are 3 bills, all authored by Senator Casey, all taking different bites at that particular apple. And while Senator Casey is kind of taking a step back because he's up for re-election this year, it's still something that we wanted to highlight in terms of trying to get better funding to HCBS programs in general, and then also trying to improve workforce issues there. As I'm sure so many of you are aware, the people that provide care in home and community settings often either aren't trained particularly well or aren't paid particularly well in those settings. And so trying to make sure that that infrastructure is given the robust underpinning that it needs is a big priority for us. So a lot of big swings that we can take at that over the next couple of years. And then of course there's access to cell and gene therapies and newborn screening. As you all have seen, the density of the number of gene therapies has increased over the last couple of years, and we're really excited about all of that. But that also means that we need to ensure that there's access to those therapies. So senators like Senator Cassidy has put out an RFI asking the community, what are the pain points in getting you access to those therapies? And we've taken a lead in responding to that and trying to inform that staff as much as possible about what the issues are in getting people access to that care. Just recently, in advance of the anniversary of ERISA coming up, Representative Fox put out an RFI asking about how individually sponsored or health sponsored plans deal with what challenges are there. That includes access to things like cell and gene therapies and other precision medications. So again, very excited to be working on that. And the newborn screening reauthorization, as weird as it may sound, if newborn screening saves lives had been reauthorized at the time that it should have been, we would this year be planning how we would be approaching the reauthorization of the program this year. Obviously, it didn't get reauthorized the last time it was up for reauthorization, so now we're doing that again. But it's also served as a really great opportunity to put pen to paper there. So we've been looking at ways the program needs to be updated, and we will be moving forward on that as we continue. Paul, happy to hand it over to you for the rest of the priorities.
All right, thanks, Joel. And really, everybody, I'm going to kind of fly through these pretty quickly because I know that we wanted to get back to some questions here. And really, for anything that we're going to be doing kind of in depth in these areas, we're going to probably be bringing them to you via Advocacy Institute later on in the year anyway. But just on Capitol Hill, as it pertains to our drug development area, you can see that there are several bills that we're going to try to get passed by the end of the year, including a bill that would incorporate patient experience data in FDA decision-making, fixing some loopholes in the Orphan Drug Act. The Inflation Reduction Act we passed last year was obviously quite impactful, but there are some things that need to be fixed within the Inflation Reduction Act that pertains to the Orphan Drug Act and incentives for rare disease drug development, and then trying to make clinical trials more diverse as well, especially those funded by NIH, while ensuring that research funding at the NIH and the Department of Defense and all the other agencies in the federal government that fund medical research are well funded. And we know the Promising Pathway Act is in conversation right now as well, and we're going to continue to be part of that conversation, make sure it really is as good of a bill as possible for our community. So finally, within the third area to cover, and that's where we've really been focusing our conversation on accessible air travel, is our empowerment and independence area. And we're not just going to stop at accessible air travel. We're also going to be working to reform supplemental security income this year. We're going to try to knock down barriers to equitable education And there's two bills there, including the RISE Act and the Full Funding is the Right Idea Act that would do so, and then also increase access to accessible housing through a bill called the VITAL Act. So I know I just said a lot in about 60 seconds, and I do apologize for that. I wish I could spend a lot more time there. But with 4 minutes in the hour remaining, there's a lot of great questions in the chat that I want to get back to because there's great questions on accessible air travel to answer, and then a couple, Joel, for you as well within the context of some of the bills. I'm going to start with just a few of the accessible air travel questions because I know those are still remaining from when Heather was with us just a short time ago. I want to go back to the training requirements because there were a couple questions about the ways in which those with disabilities can participate within training. And the good news is that actually within both the Senate and the House language for the much more robust training requirements for both baggage handlers and for airline or airport personnel who will assist with seat transfers, those with disabilities will be involved in the entire process of developing those training standards. And they'll actually have the opportunity to help implement the training standards as well. So for those of you who are asking, is there going to be an opportunity to train for those with disabilities to actually be there, to actually be part of the process of training those who are actually going to be assisting with seat transfers and assisting with the loading of wheelchairs? Yes, that is in the language. It was very important that the disability community would be involved throughout that process. As for the committees to potentially participate in, Heather kind of alluded to this, but just to add a little bit more punctuation, there are no committee opportunities or openings right now because one is dormant and the others haven't been created yet. But there will be two ways for you to find out about participating in those committees through MDA. For one, if you follow us on Twitter or X, we will be publicizing those opportunities there via our MDA Advocacy social media handle. And then also, if you're signed up for our monthly emails, our monthly advocacy updates, we'll be sure to include the opportunities when they come about within those monthly emails as well. So that, let's say it's sometime over the summer, Department of Transportation opens up positions on the Air Carrier Access Advisory Committee, you will know about it and you'll be able to apply if that's something that's of interest to you. Okay. Someone asked about the private right of action and why that did not make it into the final bill. Well, the reason for that is the idea for airlines and their allies on Capitol Hill to allow those with disabilities to sue airlines, just as folks with disabilities can sue others under the Americans with Disabilities Act. That was too much for them to accept. And as Heather said, in order to get into both the Senate and the House bills, there had to be essentially unanimous agreement, both in the context of both parties, but also in the context of airlines, as well as disability advocates, as well as other stakeholders. And the airlines and their allies were able to prevent the private right of action from being added to the bills, unfortunately. We fought very hard, but that was one of those things that we just weren't able to get into the final bills, unfortunately. No matter how hard we tried, they just wouldn't accept that. As for the lavatory rule that is being implemented right now, there is a long timeline for fully accessible lavatories on airplanes. However, there is some good news in that there's actually going to be incremental improvements going along. For example, in about 2 years, all new airplanes will have to have, at a minimum, they'll have to have grab bars within lavatories, which I know obviously is not going to be enough for a lot of folks, but for some, perhaps it will be helpful and will make the lavatory more accessible. And that's one of those things that's actually a much sooner timeline. That's only 2 years away when airplanes are going to have to start to have grab bars within the accessible lavatory. All right, let me see if there's any others that are really screaming to be asked here. Maybe as I'm doing that, Joel, are there any questions on the access legislation, whether it be the genetic counselors or Medicare and personal care assistance? Some really good questions in the Q&A there from Dan, from Cindy, from Daniel, well, from Dan and Cindy, specific to the access to care that you could potentially address.
Yeah, so for Cindy's question about how can an occupational therapist apply to be part of the telehealth services, as far as the public health expansion of telehealth services go, occupational therapists, their services do apply already. It's not an application process. They just need to bill through insurance for that. So they should be good to go as it is, do any of the legislation that would expand Medicare access to personal care attendants. So the HCBS pieces of legislation primarily focus on Medicaid, unfortunately. They focus on the Money Follows the Person program, they focus on the workforce issues, and then the one piece that may be helpful there is Senator Casey's his moonshot piece of legislation is the HCBS Access Act, and that attempts to make home and community-based care services an entitlement. So that would impact both. But in terms of the smaller swings at HCBS, Senator Casey is mostly focused on Medicaid there, unfortunately.
Yeah, thank you, Joel. But I'll also add to that, we're in conversation with the Center for Medicare Rights on ways in which we can actually increase access to personal care assistance and home health care agencies in the Medicare program as well. So while those bills that Joel mentioned are indeed Medicaid focused, there are some Medicare efforts also ongoing in collaboration with partnering organizations there. Just a couple other quick things to mention. There's a couple folks who mentioned tipping for those who assist in the airport with those with disabilities. One of the things that we actually tried to pass, and unfortunately were not successful in adding to the Senate and the House FAA reauthorization, was a bill that would, one, increase training, but also increase wages and also benefits for those who provide those services. Because oftentimes those who are in the airport actually assisting those with disabilities, they're paid minimum wage and they're not trained well at all. And perhaps in your experiences with them, that's been reflected in your experiences with them. And so consequently, we're trying to make those essentially better positions to stay within, to be trained within, and consequently, the pressure that those with disabilities oftentimes feel or are very deliberately pressured to provide a tip after assistance, that was a way that we tried to address that, but unfortunately that did not make it into the final bill. One of those other things that we really fought hard for, but just weren't able to make it across the finish line. I think what I'll do is close with one of the questions that Daniel mentioned within the Q&A box, which is how can folks help to make these things move quicker? How can folks here on our Advocacy Institute for the month, but just more generally, really help to make things move more quickly? So both on the congressional and the regulatory front, there are opportunities, and most immediately, and that's what has been placed both within, I believe, the Q&A and the chat, is the opportunity to email your congressperson today to tell them, get this bill passed. We cannot keep kicking this down the can, kicking this can down the road any further. Heather already mentioned that we've had 2 short-term extensions to the FAA reauthorization as they continue to negotiate. And unless they finish up these negotiations, that's going to continue to happen. So your emails to your congresspersons helps reiterate to them they need to get this job done, and they need to make sure that the accessibility provisions within both of these bills are indeed included within the final merged version. So that's something you could go home and do tonight if you haven't already. Another thing, though, Daniel, is that as we also mentioned with, the proposed rule that's going to be issued Thursday of next week, we're also going to be giving you all opportunities to write comments on the proposed rule shortly thereafter. So we'll need to read and digest what's in that rule starting Thursday of next week. But then shortly thereafter, maybe a week or two or in the March timeframe, we'll give everybody the opportunity to write your comments to the Department of Transportation on why it's important for them to be moving forward with these efforts. And to give you an idea of how important those comments are, when we asked you all to write into the Department of Transportation on the accessible lavatory rule, and this again is that same rule I mentioned earlier, where the airlines wanted to take 27 years to implement accessible lavatories, and the Department of Transportation was proposing 20 years. Within the letters that we offer to you as kind of here's a template, and change it as you will. The template said, let's cut that 20 years in half. Let's make it 10 years. And of the 330 letters that the Department of Transportation received, approximately 330, 90% of that were from all of you. 90% were folks writing in saying that timeline is too long. We can't wait 20 years. We have to cut that down. And sure enough, in the final rule, the Department of Transportation listened and they did exactly that. Again, 10 years is too long, but it goes to show the power of all of our voices joined together, encouraging the Department of Transportation, encouraging Congress to move with greater urgency and to move with greater rapidity to make air travel more accessible. So Stay tuned for that opportunity coming in March. Again, we'll have an advocacy institute specific to that, so you'll learn everything that is going to be within that proposal within a to-be scheduled date in March. And in the meantime, rate your congressperson and join us. If you aren't already signed up for our updates, because we update you all with our advocacy institutes, with their monthly emails and so forth, join us at what you see on the screen here, texting MDA USA to 50457, or visit us at mda.org/advocacy. And again, I know we didn't get to everybody's questions, and I apologize for that. If we didn't get to your question, email us at advocacy@mdausa.org. And myself, Joel, others within the team, maybe we'll even get Heather involved, can answer any question that you have that we didn't have a chance to get to tonight. So with that, I appreciate everyone staying 7 minutes longer than we asked you to. Appreciate your time this evening. Thank you again for joining us in our cause and this advocacy, and we'll see you again very soon. Thanks all.